If it wasn't for the community healthcare clinic, I wouldn't be able to get my insulin for my diabetes.
Even though I work, I rely on the community healthcare clinic for my healthcare needs.
If it wasn't for the community healthcare clinic, I would not get the care that I need.
What began as a twice-weekly evening volunteer clinic has evolved into a patient-centered medical home that prioritizes patient needs and is focused on the provider-patient relationship. Throughout our 20-year history, our true success is the trusting, compassionate relationship we create with our patients.
Our motive was, how can we help people get care early? How can we prevent people coming into the hospital emergency rooms at a crisis stage, at a late stage, when they were more at risk, and also the cost of care was higher. I guess what I'm most proud about the Community Healthcare Clinic is that it is a local initiative done by local people to serve local people. And I miss that in our world today. I think looking back, I'm just very thankful that we were able to come together as a community to figure out a way to do something better and to get better results to those who really needed the service and the help.
We agreed to see patients and treat patients for their cardiac problems. And over the years, because of the nature of what we do, we've had some very complicated people who've required caths and bypass surgery and stents and defibrillators and chronic blood thinners for their artificial valves, whether it's labs, x-rays, invasive, non-invasive tests, surgical procedures. So I don't know the dollar amounts, but I know it's been in the millions of dollars over the years, and I think that's a great gift from the hospitals to the community.
We did have advanced practice nurses early on, and when we hired Allison Watkins as the executive director, she was a nurse practitioner, so she could not only hold the executive director position, but also provided patient care. You know, establishing the pharmacy, Ann Culleton did that, another nurse, and she did a fabulous job. We had, you know, getting the medications stocked and being in line with all the laws that are out there and what have you. Getting the volunteers, there was a lot of excitement.
Hypertension, diabetes, these kind of things people would die from. They did not live long lives. And so when we first got involved with thinking about what's this clinic going to be like, I think one of the things that we didn't know was how much people were suffering from chronic illnesses that were going untreated.
Soon after I came to town in 1994, I actually started working at the clinic itself when we opened up the pediatric clinic. My first 2 clinic patients were a 4- and 6-year-old sister pair. They were very darling, but they had a lot of vim and vigor going for them. Over the course of the year, I think I saw them 6 to 8 times for various ailments. They grew up and left the clinic. Didn't see them for a while, but just about 6 months ago actually ran into their mother, who became a patient of mine. And the oldest daughter is getting ready to have her first child and was asked to be remembered to me for the times that we spent in the clinic, and it was very heartwarming for them to remember me, and that was nice.
And we were just struggling to get it so we had enough stethoscopes to listen to pulses, and who had which equipment that we needed, because we were sharing the clinic with the prenatal clinic, and all the hazards that went along with that. It was fun. I think one of my most proudest moments was we hired nurse practitioner Sue McGinnis right out of her nurse practitioner program. We needed a nurse practitioner, and we hired Sue, and I'm just delighted she's still there.
The clinic has grown considerably since I first came in 1998. Back then, we shared the building with the prenatal clinic, and so we only had half the space, number one, and had to share exam room time, so we just flat out couldn't see as many patients. And staff-wise, we had an executive director, the clinic nurse, and me. And all of the rest of our staff at that point were volunteer staff. Just the sheer number of patients that we're dealing with, of course, has significantly increased. Now we're really blessed to be able to have 3 part-time nurse practitioners that are also assisting. What's been constant, of course, is the physician involvement and being able to have physician volunteers come in and see patients as well.
And the clinic has really good people. I really appreciate the nurse practitioners there, and they're out there on their own, and there's a lot of orthopedic problems that are really difficult to analyze and difficult to interpret, and I am more than willing to be able to help them. I also will field many calls from Mike and the nurse practitioners, and so there's a lot of communication. I get to go in there, I get to see them, and they tell me thank you, and yet it's Mike and Laura and everybody behind the scenes that have done all the work.
I was interested in coming to the clinic because it offered a whole new experience for me. I had not had any exposure to the Hispanic population. I had had a little exposure to the homeless, but not a lot, and I just felt it was a population that I would like to serve.
He just loved the place once he got in here. It was a challenge at that point to set up the pharmacy. He liked the idea of it, and he loved all the people he worked with. He looked forward to coming. I do know that he did recommend people to come here, and then he would, there was one in particular, he would run into her in she worked in a restaurant, and he followed her until he was sure she got in here and got enrolled and was taken care of. It was very hard for him to give it up, probably about 2 years before he passed away. And he'd have kept coming. That was hard for him to give this up. To him, it was a combination of doing something good and his profession.